Thank you. And now recognize Mr. Gifford for 5 minutes for an opening statement.
Good morning, Chairman Griffith, Ranking Member DeGette, and members of the subcommittee. Thank you for inviting me to provide testimony today. As we gather here today, we can talk credibly about the end of the HIV epidemic in our lifetime. The 340B program is vital to attaining that goal. My name is Mike Gifford. I serve as the President and Chief Executive Officer of the AIDS Resource Center of Wisconsin. Earlier this year, ARCW expanded our services into Denver, Colorado, and the unique model of care that we offer. In total, we serve more than 4,000 people with HIV. The 340B program costs the federal government nothing, yet generates hundreds of millions of dollars in care for HIV patients. For HIV patients, the purpose of the 340B program, to stretch scarce federal resources, to serve more patients, and to provide more comprehensive services, is met every single day. We assure unfettered access to medical care, dental care, mental health therapy, drug treatment, and pharmacy services, tightly integrated with social services like case management, food assistance, and housing. More than 90% of our patients are low income, and 1/3 of all of our medical visits care for uninsured patients. Our patients achieve some of the finest clinical outcomes in the country, 89% of whom achieve the gold standard in HIV healthcare, an undetectable viral load. That is a rate far above the national average. Governor Scott Walker's administration has found that our patients are so healthy, they cost the state of Wisconsin 30% less than HIV patients cared for elsewhere. Further, DHHS data shows HIV patients in Wisconsin have the lowest HIV mortality rate in the country. Our HIV medical home, buoyed by 340B savings, result in people with HIV living in Wisconsin longer than anywhere else in the country. At ARCW, 340B savings are used consistent with legal and regulatory requirements. Savings have supported opening an opioid treatment program in Green Bay, expanding mental health services throughout Wisconsin, launching clinical pharmacy care in Denver, and increasing the number of patients we care for throughout all of our services by more than 1/3. Last year, ARCW generated $7,429,666 in savings, the exact use of which is included in my written testimony. To track 340B medications and savings, we have developed specialized software that monitors compliance related to patient eligibility, diversion, and duplicate discount. We audit ourselves on a monthly basis and have an annual third-party external audit. Last year, it showed 99.57% compliance. This year, our compliance rate is at 99.9996%. As the subcommittee reviews the 340B program, there are critically important policies necessary to achieve that goal I mentioned earlier, a world without AIDS. The current patient definition used for Ryan White grantees must be maintained to support the integrated care necessary in achieving substantially better clinical outcomes. Without it, there will be fewer resources, worse outcomes, and increased healthcare costs, not to mention the substantial difficulties for the people we serve. Separately, the use of 340B savings for Ryan White grantees has been limited, prohibiting their use to extend access to 1, life-saving PrEP services, 2, expand the number of locations we can offer our care, and 3, assure the financial sustainability of our providers. These regulations create significant barriers to ending AIDS. Statistics and advocacy tell only part of the story. Briefly, let me tell you about one of our patients, Kathy. She came to us newly diagnosed with HIV 20 years ago, struggling with substance abuse. Through our drug treatment program, she entered a life of sobriety. Kathy then accessed medical care, housing, food services, and mental health therapy to achieve that gold standard in care, an undetectable viral load. She proceeded to meet her boyfriend and relocate to another town. Just weeks later, we received a call from Kathy. Her boyfriend turned out to be a domestic abuser. We rushed to her aid, removed her from harm's way, and provided her a safe home. She was no longer being beaten. Sadly, she was no longer undetectable. Today, she's accessing many of our services and is back on the way to that gold standard. Throughout it all, our services were always there for Kathy, even if she couldn't pay. Each one of them supported by 340B savings that saved her life. Thank you for this opportunity to testify before the committee. I look forward to responding to any questions you may have.